Investigating a crash that happened near Kerman this afternoon, officials say a pickup truck traveling southbound on Howard drove through a stop sign and hit an SUV traveling westbound on Kearney. 2 passengers in the pickup were taken to the hospital along with the driver of the SUV. Authorities tell us the man driving the truck remained at the scene and was being held on suspicion of driving under the influence.
Okay, ready? 1, 2, 3. Nursing. Good afternoon, my name is Destiny. I'll be your nurse today. Can I get your name and last name, please?
Clarissa Jones,
Okay, can I get your date of birth?
10/12/90.
Do you know where you're at?
No.
Okay. Do you know what happened?
No, but I'm in a lot of pain.
What would you rate your pain level on a scale from 0 to 10?
Like a 13.
Okay, I will have the doctor order you some pain meds, okay? I'm gonna go ahead and listen to your lungs. Okay, can you go ahead and open your eyes? Miss Jones, can you go ahead and give a squeeze to my fingers? Okay, I'm gonna go ahead and remove the blanket. Can you move your toes for me?
I can't.
Can you push down?
I can't feel anything.
Can you push up?
I can't feel anything.
Okay, Miss Jones. I'll go ahead and call the doctor and she'll be in a second to talk to you, okay? And I'll have her get the pain medicine as well.
Okay, thank you.
A spinal cord injury is a serious condition that can be fatal. Depending on the injury site, correct emergency management may be crucial because moving a patient incorrectly can lead to further permanent damage to the spinal cord. Accidents are the most common cause of a spinal cord injury. After the patient is stabilized and the head-to-toe assessment is done, the nurse notes that the patient is experiencing pain. The nurse makes sure to get an order from the doctor, such as opioid and non-opioid analgesics to control the pain. The nurse also noted that the patient has no feeling on the lower extremities, indicating a spinal cord injury. The doctor then decides to order a CT scan, which will reveal which spinal cord level is injured.
Hello, Clarissa. How are you feeling?
I'm in a lot of pain.
You're in a lot of pain? Okay, well, my name is Dr. Lopez, and I'm going to be taking care of you today, okay? We're also here with my nurse. I see that you have no sensation on your lower extremities? Okay, that's fine. We're going to order a CT scan, okay?
What's a CT scan?
It's just a type of x-ray to see what exactly is going on down there, that you're having no sensation.
Okay.
All right, so CT scan? Okay, please. Okay. Hello there, Clarissa. So I have gotten your CT results, and it shows that you have a spinal cord injury. So that is the reason why you're having no sensation on your lower extremities, okay?
What does that mean?
It means that it is unlikely that you will be able to regain the use of your legs.
Like ever again?
Sadly, I cannot answer that, but I will refer you to a rehabilitation person, and they can give you further information on that, okay?
All right.
In the care plan, the nurse makes sure to include interventions regarding lower extremity weakness. The nurse will ensure to assist with range of motion exercises to increase strength to the extremities, enhance circulation, and prevent muscle atrophy. The nurse will also inspect all skin areas to prevent any breakdown because of the inability to sense pressure in the lower extremities. In addition, the nurse will ensure that the patient gets repositioned to reduce pressure on bony prominences. The nurse ensures to explain to the patient that in the initial treatment, corticosteroids are going to be given to reduce spinal cord edema and decrease potential damage to the spinal nerves. Since the client is now stabilized, the nurse explains that the injured portion of the spinal cord must be immobilized using a spinal brace, and that if the injury gets worse, surgery may be needed to stabilize the spine. The nurse then explains that after the initial treatment, therapy will be received to help rehabilitate the patient in order to restore strength and prevent muscle atrophy.
Patient was taken to the hospital after her car accident. In these cases, it is vital to rush them to the hospital as soon as possible in order to prevent further damage. Upon her arrival, she was given steroids to reduce the swelling of her spinal cord, and surgery was done to stabilize her spine. Now, as she is working with physical therapy in order to restore her muscle function, strength, and range of motion, she is learning how to use her wheelchair to the best of her abilities with little assistance and progressing very well.